Earlier today, I spoke with Stephen Morrison. He's the director of the Global Health Policy Center. That's a political think tank here in Washington. For more on the Ebola outbreak, he was able to provide an indication of just how bad things are and how it reached epidemic levels.
This outbreak of Ebola in West Africa is the largest, most severe, most extreme outbreak we've had, dating back to the 1970s when the first cases happened. It's extraordinary in three ways. The numbers of cases, over 760 cases, the number of fatalities recorded, around 467, the fact that it jumped out of its original country of origin, which is Guinea, into two neighboring countries. So the geographic spread is unprecedented.
Stephen, a senior official with Doctors Without Borders is saying that he believes this outbreak is totally out of control. What's your read?
In West Africa, we have a pocket of exceptionally weak public health infrastructure. We have exceptionally weak and porous border controls. And so it is quite possible to imagine that this could move into other neighboring states that also are weak. And at the end of the day, what this is a huge wake-up call around how pockets within the world have these huge endemic weaknesses where an outbreak like this can begin and can amplify and spread very, very rapidly. If this were SARS, or if this were MERS, the Middle East respiratory syndrome, something that could be carried out of that region into the United States and have much higher transmissibility, we would be in very, very serious predicament right now.
When do we turn the corner?
The long-term fix is to create institutional capacity to prevent, detect, and respond to outbreaks. These governments don't have those capacities. They can't even recognize they have an outbreak until 3 or 4 months later and confirm it. So it's a wake-up call about the world. For the world to be safe requires closing the gaps in these areas like West Africa, which have exceptionally weak public health capacities. It's going to take a change of outlook on political leadership. It's going to require data sharing and across borders and cooperation with the WHO and CDC at a much higher level. It's going to require public education campaigns and deliberate efforts to restore public trust, because panic is deepening in these situations, and rolling that back is very, very tough. But you can bet that unless the governments rally to create the capacities they need, this pattern is going to repeat itself. And if it repeats itself next time with something like MERS, it's going to be a much bigger threat to world health and health security than this one is.